I think there are some encouraging things in the data right now. I mean, for one thing, we haven't reached the levels that we saw earlier this year in January and February and last December yet. And hopefully we never will again. But even just right now, one thing that we're not seeing yet is an increase in deaths. Deaths are still pretty much flat so far. And there's a couple things to note about this that are important. Deaths are a lagging indicator. So we've just started to see this rise in cases and hospitalizations. So you wouldn't expect to see a rise in deaths quite yet. But there's a chance, I think, that we might not see as much of a rise in deaths for a couple of reasons. One is that elderly people in Alabama are the most vaccinated cohort of people in the state. I think both age groups 65 to 74 and 75 and up they're both over 70% vaccinated. And as we know, those during the pandemic last year anyway, Delta may behave a little bit differently. We're not quite sure about that yet. But those groups tend to be more vulnerable. So the fact that they're vaccinated could mean that they are less likely to have severe outcomes from the virus. And then also the fact that, Alabama does have a small population of people vaccinated, but it's still a third of people. And then those people may have breakthrough cases, but even if they do, they're much, much, much less likely to have severe outcomes. So those two things combined could mean that we might not see as big a spike in deaths as we did earlier this year.